I am Kelsey Johnson from Smith.ai. If you don't know Smith.ai, we are a virtual receptionist and chat service for businesses. Our receptionists can answer calls, chats, texts, and Facebook messages. We can transfer calls and take messages, qualify and intake new leads, book and reschedule your appointments, and much, much more. If you're interested or you want to get a free consultation of our services, please head to Smith.ai. Today, I'm really excited. We have Eve Epstein on to talk about ways to save on your health insurance in 2021. This is specifically for small business owners and freelancers. It should be a lot of really useful information. We are going to do about 30 minutes on this webinar, but we are going to stick around at the end for any questions that you might have. We have plenty of time to cover any of that. Eve Epstein is the CEO and the co-founder of SoleVenture, which is a back office platform for freelancers. Eve practiced labor and employment law at the US Department of Labor and the National Treasury Employees Union in Washington, DC. And she has served as in-house counsel to one of the largest privately held professional employer organizations. She specializes in wage and hour law, employee benefits, and HR tech. In her years of practice, she observed the rapid growth of the freelance economy and their unmet needs, from insurance and cash flow management to gaining new work. She started SoleVenture to offer self-employed workers the financial security and benefits of traditional employment. She is a licensed insurance broker, and she's licensed to practice law in Florida, Washington, DC, and Maryland. So I'm going to go ahead and let Eve take it away now and start her presentation.
Thank you so much, Kelsey. And hopefully I am not muted right now, so you can send me a chat.
Yes, we can hear you.
Great. So thank you for that introduction. This is a really good opportunity to be talking about health insurance right now, particularly because many of you know this is the time of year when we're all figuring out our plans. You can go to our website at SoleVenture. We are a mobile app, but we also do have a quiz to kind of help you have a guide on what you should be doing for your health insurance this year. So we're going to cover a number of things in this brief overview. One, how open enrollment works and special enrollment, premium tax credits. For those of you who are small business owners, you might be familiar with the different types of HRAs. So we'll briefly cover that. Premium deductions, alternatives to traditional insurance, and what we can expect in 2021. So let's jump right in. So time is running out for open enrollment. It's gotten shorter over the past couple of years, and it only started on November 1st and will end on December 15th. So we really only have a little bit of time left. This is going to be your selection for your plan for all of 2021. There are a couple of different ways that you can get onto the marketplace. So when we talk about open enrollment, we're talking about that period of time that you're signing up for the ACA. There is, of course, healthcare.gov. You can use ACA navigators. We're finding that it's a little bit easier to access other carriers and providers who can walk you through that enrollment. Because if any of you have purchased insurance in the marketplace, you might find that it's a little complicated. So we've actually partnered up with Health Sherpa. There are a lot of very similar companies that offer advisors who can walk you through that enrollment. So let's say December 15th comes and goes and you ended up not signing up for insurance. You're not totally out of options. We have what's called special enrollment. Now, a lot of you, if you were at all impacted by COVID this year, that actually became a special enrollment period for workers. Generally, the way special enrollment works is that there needs to be a significant change in the past 60 days. So this could be changes in your household. You got married, you got divorced, there was a death in the family, you had a child, you adopted a child. Could also be changes in residence. So this could be that you simply moved to another zip code, or you became a student, or you became a US citizen, all of those would fall under a special enrollment category. There's also the loss of health insurance. So this doesn't apply if you ended up not signing up for open enrollment this year and then are looking for it. That's not a qualification for special enrollment. But if, let's say, you had it through an employer or you had it through your spouse and you've lost it because you lost your job or you went through a divorce, then you would be eligible to sign up for special enrollment. And there are a couple of other different categories, but the fourth most common time that special enrollment would happen is, like I said, we're going to discuss what ICRAs are and QSARAs are, but that's if you have an employer who newly gives you access to a health reimbursement arrangement, then you would then qualify to be able to go onto the marketplace and sign up for health insurance. The main thing to keep in mind is when this change happens, you have 60 days to act. And it can take a while for you to review your different options and make those decisions. So it's a pretty short window. All right, so premium tax credits. This is how individual insurance can be made a little bit more affordable. There are essentially 4 steps for how premium tax credits could ultimately apply. So you have to qualify for each of these. 1, you have to have a household income that falls within a certain range. So generally, there are always exceptions because I know that there are a lot of lawyers in the audience. There's always a caveat. But generally, your household income must be at least 100%, but not more than 400% of the federal poverty line for your family size. So if you're an individual and you're not married, that's going to mean generally around like a little under 13,000 to a little over 51,000. So you can actually be too low income to access premium tax credits. At that point, you might be looking at something like Medicaid. So the next step is you just need to not file your tax return as married filing separately. There, once again, is an exception to the rule, but that's pretty straightforward. You can't be claimed as a dependent by another person. And then the last one, that's the real trigger here. So in the same month that you're buying this insurance in the marketplace, so you're getting coverage in the marketplace, you also need to be eligible to get that coverage because you can't get it through an employer. So your employers, if they are over 50 employees or more, they're required to provide you some sort of minimal viable insurance. And so if the employer-sponsored plan is not considered affordable coverage, you can go on the marketplace. You also can't be eligible for some sort of government coverage like Medicaid or CHIP. And then the final part is that you need to pay whatever your share is of the premium that wouldn't be covered by advanced credit payments. So for those who don't know what advanced credit payments are, because this is how insurance works. So advanced credit payments are when you are deciding what your coverage will look like and how much you'll pay, you're estimating what your income will be. And based on that estimate, you actually are given the option of applying an advanced credit towards those premiums. So instead of you lowering your cost at the end of the year through your return, you instead can apply those credits directly towards your premium payments. Whatever is your remaining share, you do need to pay in order to access premium tax credits. But that's basically all it takes. So it's generally income dependent. As we've been talking about, timelines are the key here. So all of these things need to happen in that same month that you're signing up for the insurance on the marketplace. And then there are premium deductions. So some of you are freelancers or self-employed. Some of you are employees. The way that premium deductions work is across the board, you have to be someone who's itemizing your taxes. And because we have a really high standard deduction, not everyone is going to be itemizing. And so whether that makes sense for your income will depend on essentially how much money you're earning, your adjusted gross income. If you're an employee, for any medical expenses, and that includes your cost of premiums, but also any allowable medical expenses related to your health insurance, if it exceeds 10% of your adjusted gross income, the remainder you can deduct those premiums on your tax return. If you're self-employed, you get a little extra buffer. So you have to still be itemizing, but you can, at the outset, take what's called a self-employed health insurance deduction. Because you take this deduction first, this will lower your adjusted gross income before this third part. And they lower the threshold for self-employed people to make these deductions for greater than 7.5%. So I'm not an accountant, and I'm not going to give you any sort of tax advice, but I can say that for self-employed people, there are a number of ways that you can use deductions to lower your overall premium cost. As we know, individual health insurance is more expensive than it is for group insurance. So that's why these deductions are in place. That's why we have premium tax credits. For the most part, that it lowers the vast majority of the costs for folks. But if you're higher income or significantly lower income, you can't really take advantage of these credits or deductions. So I mentioned before that we're going to talk a little bit about ICRAs. We actually here at SoleVenture for our own employees use this because we're a small business ourselves. This is a way for you to cap costs. So if you have a couple of employees or you're a part of a really small business, you might want to tell your boss about this option. So in 2017, there was a new type of health reimbursement arrangement called a QSERA. So some of you who've been small business owners for a little while might have already heard of that. ICRA is basically a supercharged version of QSERAs, and this started in 2020. So this is fairly new. It gives a lot of flexibility for the employers to be able to reimburse you for your health insurance. The employer gets to design their plan. And by design, I mean they get to choose the eligibility criteria. You know, they might be basing it on full-time employees versus part-time, or base it on seniority. There are a number of different ways that they can define their reimbursement limits. And then what it allows employees to do is to go buy their insurance in the individual market. So like I said before, this is a special enrollment qualification. So if your employer decides mid-year to establish an ICRA, you can go on the marketplace, but you can also, work with a broker to get your individual insurance. So you actually have, as an employee, a lot more flexibility, and the employer, it's a way for them to control their costs. Then the employee would then submit their claims for reimbursement, and the employer will decide whether they'll reimburse for just premiums, or they'll reimburse for expenses, or reimburse for both. But it's a pretty straightforward process. And then that money comes back to you tax-free. So the employers will reimburse for all those claims tax-free, and they can just put it straight into your paycheck every month. So that's a way for, if you're a small business owner and you've looked at your different group coverages, and maybe because you have some folks with pre-existing conditions or some older folks, maybe the cost for the plan is prohibitive for a lot of your employees. Or maybe you have a number of employees who are already getting coverage through their spouse, so you only have a couple of people who'd be on your plan. Health reimbursement arrangements are a way for you to know what your costs are going to be in advance. You're going to say, for example, I reimburse each employee $500 a month. That way, next year, if premiums go up, you've controlled your cost. You know exactly what it's going to be next year. And your employees, for those who want maybe less coverage or need more coverage, they have more flexibility because they're not choosing a plan that you designed or you're sponsoring. Instead, they get to access it through individual carriers or going on the marketplace. Now, I've spent a while here talking about how you get major medical insurance. And I think what we need to acknowledge is that's not a right fit for everybody, especially for freelancers who are young and healthy, small business owners. You might want to look at alternatives. And there are a number of them. Some of them are garbage. So you have to be kind of careful here. And there are a number of regulations to keep you from trying, accidentally buying the wrong type of plan. But I think that's why we all get nervous about not just having traditional major medical insurance. Some of them are great. One type of alternative is called an indemnity plan. So since I was told there's some lawyers in the audience, I think you kind of understand this concept, that it's basically you're going to have a set amount of coverage. So it's going to guarantee you compensation for, let's say, you want $2 million worth of coverage. The carrier will cover $2 million for that year. You will then pay a premium each month that would be significantly less than traditional health insurance because it's not working like health insurance. Instead, it's working as self-pay. They're guaranteeing you that they're going to cover you for that amount. And then you go to your various providers as if you're like paying in cash, as if it's self-pay, because it works like cash. It doesn't work through a middleman of an insurance carrier. Another option a lot of you might have heard of are healthcare sharing plans. And it was until recently, and still probably more commonly, something affiliated with like healthcare ministries. So they're often faith-based. They don't necessarily require you to have a certain faith, but because they're faith-based, there are some limitations on what the coverage may entail. Often things that would end up being limited would be things like contraception. The way a healthcare sharing plan works is instead of paying a premium and paying a copay, you instead are paying a set share to be a part of this healthcare plan. And that kind of works like a premium. And then you also pay a portion of your own medical expenses when they occur. So then that kind of works like a copay. So while they're distinct from traditional insurance, you can actually pool people together, join one of these healthcare sharing plans, and lower your costs if everyone in the group is generally about the same demographic. It can get really expensive because it's not as predictable. If you weren't anticipating a certain medical expense, or you're expected to share more because someone had a catastrophic injury, then that's going to be a burden you're sharing. But it's a way for groups to come together as an alternative to an employment-based group. Similarly, there are association health plans. Association health plans are for small businesses to band together and join on one health plan. And they either need to have some commonality with the industry that they're in or some commonality geographically. But this could be another way if you're a small business owner trying to control your costs, finding that you're not able to get group coverage, probably ineligible, or don't find that the coverage is good enough through a PEO. It's another way that you can kind of band together in an association. This is often really good coverage, but there are significant limitations for self-employed people. So if you're a business of one, who's the SoleVenture audience, you cannot join an association health plan. You do actually have to have at least one employee to be eligible to join. And then the fourth alternative I just wanted to briefly cover, and there are many other alternatives, it's direct primary care. So direct primary care is exactly what it sounds like. It's basically you are paying a set amount for your physicians for a set type of primary care services. This gives you flexibility if you just really like your physician. Instead of having to go through your insurance company, you're directly paying that provider. And usually physicians will be a part of a network so that you're not just having one doctor, but you have your go-to chiropractor, your go-to medical, your go-to dentist, all in one network. You pay a set fee and the money goes straight directly to the physician. So there are a lot of alternatives out there. We have some good providers that at SoleVenture we work with, particularly with indemnity plans, because we find that not everyone's a good fit for major medical insurance. So if you are looking to explore, like I said, we do have a guide on our website so that you can see whether that's the right type of coverage for you. And I don't know if anyone follows the news, but there is going to be a change in 2021 in the White House. So I don't know if that's a surprise to anyone. So what is 2021 going to look like, or the next administration going to look like? That's not really clear yet. What we do know is the Biden administration has already put out a number of items in their goals for how they'll manage healthcare. And so these are the things that you're going to see coming up over the next couple of years. Obviously, there's, whether the Senate's going to allow that to happen. So things, politically can end up being more difficult. But there are 5 things primarily that the Biden administration said to anticipate. One is they're looking to do a public health insurance option. It's not going to be Medicaid for all, but it will look a little bit more like Medicare if that passes. Another is, we were talking about the tax credits before. They're capped significantly. And so one of the things for middle-class workers is to expand the premium tax credits so it can further lower your premiums. Another issue with the premium tax credits is right now, the tax credits are based off the bronze plan, which is, kind of the least amount of coverage, highest deductible plans. Biden's proposal is to do it off the gold plan. So that would actually give you access to more credits and make it easier for you to purchase the highest level of insurance. The 4th thing that they've discussed is doing a Medicaid expansion. So that would just, before when we were talking about the 100% of federal poverty level or lower, that would probably expand in certain states where they have a lower threshold. We're here in Florida. Our state legislature has consistently rejected Medicaid expansion. So one of the proposals there is to require states to expand more, usually by throwing more money at the state. And then the 4th is to allow for better negotiation on pharmaceuticals. So for a lot of you out there, your health insurance might not be that, might be affordable, but your prescription costs are really high. So one of the ways that they're looking to address it in the future is to use Medicare, which is where the vast majority of people get their insurance, give them the negotiation power with the pharmaceutical companies, which would then lower everyone else's prescriptions. So those are all the promises that are coming. We'll see what happens. But I would anticipate that given the administration change, the ACA is going to be here to stay for a while longer. I don't think we're going to have Medicare for all. So it's going to be some sort of hybrid where, based on your needs and your family's needs, you may still be considering not going for major medical and could consider some alternatives to traditional insurance. So that was all I had covered.
That was very, very wonderful. Truly enlightening. I can only imagine that that was very useful. We do have a couple of Q&A. I'm going to go ahead and share my screen now so that to just put our information up so that if anybody wants to reach out, can you see our information up here?
I did for a second. There we go.
Yep. Okay. And I'm going to go ahead and go over some Q&A if that's okay,
Yeah.
Eve. What are the options for people who have pre-existing conditions and are self-employed?
So that's the great part of the ACA, that pre-existing conditions you cannot be discriminated against and prevented from getting coverage. And given that we're going to have this administration change, that's going to be preserved. It likely means that the best option for you is major medical, however, because a lot of those alternatives I talked about, the way that they control their costs is by excluding people who may have really costly pre-existing conditions. There are a lot of different pre-existing conditions, and some of them are more expensive than others. As we know, being a woman is sometimes considered a pre-existing condition. So some of them will be more costly than others, and so you still could evaluate your options. But usually major medical is the best option for you if you're self-employed and have a pre-existing condition.
Fantastic, thank you. All right, second question that we've got. I am an employee of my own LLC law firm and have no other employees. Which category is this person in and what can they do?
Yeah, so you are self-employed, so you would not qualify for an association health plan. You could not create a health reimbursement arrangement just for yourself. However, because you're an LLC, there are other deductions that you can make to basically use your health insurance as a business expense. So you have more ability to write off those expenses, but you would still be treated as self-employed.
Fantastic, thank you so much. The last question for right now, and please, if anyone else has questions, go ahead and drop them in the Q&A and we'll field them. Is Samaritan Given a good health sharing plan for a solo business owner?
So I'm not familiar with this particular plan. I would say for any sort of health sharing plan, there are a couple of things I would look at. One, look at the limitations on the coverage. So as I mentioned, because these faith-based health sharing plans are based around faith, they may exclude certain procedures or prescriptions that you and your family might want. So keep that in mind. So usually it's involving contraception, but there are a number of things that just end up not being covered. The other issue that can come up is you want to take a look at how long-standing this plan has been in place, how many members there are. Because you're each sharing a cost, think of it kind of like a union or something. You're each putting in your money, you're each kind of responsible for each other. If it's a really small plan or it's not well established and they don't have a lot of money, then you could end up being on the hook and not really have very good coverage. It may not be ACA eligible, which means that if you lost that coverage, you wouldn't qualify for special enrollment. So those are the two things I would look at. Take a look at how long it's been established, how well funded they are, and then also whether their limitations can affect you and your family.
Thank you very much. Okay, we've got a couple more coming up here. Hi, I am in an LLC as a member/owner with one other member owner. I need to get health insurance for the two of us and missed the first 15 minutes. I apologize if you addressed this in the beginning. What is this person's best option? And I will say we have recorded this and it will be going up on YouTube today, and I'll send out an email to everybody who registered. So you will be able to watch the first 15 minutes again if you'd like, but maybe if Eve, you could quickly address this person.
Yeah, so I'd say you have three options. One, even as a very, very small business, you can get group insurance. It's probably not the most affordable option. Option two, which I think is probably going to be the best one for you, is to look into the ICHRA. So if you miss that part of the coverage, take a look at the recording. But that's a way for you to control your costs and give you and your fellow member more options. The third is if one of the two of you wants to get non-traditional, or one of the two of you ends up, being independent or being on a spouse's plan, you can have other ways that you kind of reimburse or lower their costs. The biggest difference will be going through an ICHRA, it's tax-free. If you just give them extra money to be able to use towards their health insurance, that's taxable income.
Okay, thank you so much. A couple more questions coming in here. Do you find that only the bronze, which is the high deductible, least amount of coverage plans, are the only plans available to people with pre-existing conditions?
No. So on a personal note, my wife is a breast cancer survivor, and we would never go for the lowest plan, mostly because we need more extensive coverage. That obviously is a pre-existing condition, and we can do a gold plan. It just costs more money. The benefit of the Affordable Care Act is that pre-existing conditions will not block you from getting affordable coverage. There are other ways that you can lower your costs of your premiums, but no, that would not just set you to the bronze plan. And in fact, you might, if you have certain pre-existing conditions, you might want to look at greater coverage, because if you're going to be regularly going to the doctor and you have a really high deductible, you're going to be spending that money out of pocket, and you may have significant copays. So the gold plan might actually make more sense for you, even if the premiums are fairly high.
Great, thanks so much. All right, the next question we have is, we are a small law firm with 9 employees. Which option would you suggest for them, if any?
So you're still a really small group. I would get some quotes from brokers to see for a small business plan. But I personally am a big fan of the house reimbursement arrangement. I would say if you are under 15 employees, I would explore that option first, especially with 9 employees. Percentage-wise, you're bound to have a couple who are going to be on their spouse's plan anyway. So if you only have a handful of folks, an ICHRA is probably the best solution for you to control your costs and give your employees the most options.
Great, thank you. Okay, this one's a little bit longer, so I'm just going to go ahead and read it out. This person was trapped in a high-pressure sales pitch and ended up with first enroll in something they call multi-plan PPO. They are 59 and have a pre-existing condition, arthritis, for which they have not been treated in more than a year. Should they trust the people when they tell this person that they don't have a pre-existing condition since they haven't been treated for more than a year?
So I don't know the specifics on arthritis. Pre-existing conditions, the length of time does depend on the type of condition. So I know, like cancer or diabetes, it's a longer length of time versus things like arthritis. So I don't know offhand, honestly, whether that's something you wouldn't disclose. You do want to be careful though, when you do have a pre-existing condition and you don't disclose it on the plan, and then they find out after the fact that you were treated within that length of time that they measure for pre-existing, then that can be cause for denial of certain coverage. So I would not just trust, and I'm sorry that you were pressured into signing up for something. I don't know if you have the ability right now to go through open enrollment and look on the marketplace and see some other options that might be better for you.
Thank you.
You have until the 15th, guys.
Still 2 more weeks. Well, almost 2 more weeks.
I know.
Okay, next question. For those of us who are losing income because one spouse may be losing unemployment, would that reopen the window at that point, or should they try to get insurance now?
So if they lose employment and that's how you were getting your coverage, then that would be a change in circumstance for special enrollment. I don't recommend waiting for that circumstance to happen when we're in a period of time that there are no conditions for you to sign up. Explore your options. We're actually finding that premiums haven't risen that much this year. They've gone up a bit, but you're better off doing it now and getting your family protected than risking what might happen and see if you're potentially eligible for special enrollment. A reduction in income is not a qualification for, or a loss of unemployment is not a qualification for special enrollment.
Okay, thank you. The last one for now, but we are going to stick around and answer questions for as long as anyone needs. And also, again, we are recording this and it will be up on and available to watch later today. If you pick, I think you pronounced it ICHRA, but ICHRA,
Okay,
and
yeah.
some employees are on their spouse's plan, do you still offer ICHRA to them? And do you offer it to all employees?
So like I said, the employer has the flexibility to design the plan. If they elect to stay on the spouse's plan, then they're not going to be eligible for the health reimbursement arrangement. However, you can decide you want to offer it to all employees, or maybe you would do all full-time employees. You can choose the eligibility criteria. It just needs to not be discriminatory. But you can choose to offer the ICHRA to all your employees, and those that choose to stay on their spouse's plan because it's more affordable on their spouse's plan, there really isn't any other money you can give them. There are other incentives you can do, but nothing else tax-free.
Okay, thank you very much. I think that this question that came in through chat. Okay, this is a new question that came in on our chat. This person owns a law firm as a PC and they are the only employee. They had a catastrophic illness 3 years ago and they have totally recovered. They are not on any medication and lost weight and doing great. Congratulations, I'm glad. Just turned 65 last month and it seems Medicare is not great insurance. They're thinking of getting private insurance through the firm, like ABA insurance or perhaps an indemnity plan or another option. And they're wondering what you recommend.
Yeah, so, obviously I only know so much of your circumstances here. So Medicare can be great coverage. There are supplemental parts. So there's like Medicare and then there's, Part D and I think Part E, and this is not my specialty. So I just want to be transparent about that. But Medicare can be very good coverage. If you're thinking about private insurance, if you're meaning the American Bar Association by ABA insurance, that's probably not going to be better coverage for you. I don't want to dismiss anything, but it's kind of, it's association plans. And I also think an indemnity plan at 65 with pre-existings, it's going to be more expensive than Medicare. So I actually think what you want to do is not just get Medicare, but you want to look at the supplements. I'm happy you're made such a good recovery and you're doing well. I think Medicare could actually be pretty good coverage for you.
Okay, well, great. Thank you very much. It looks like we do have one more question that came in on the Q&A. This person is an LLC, or I assume owns an LLC, and they're the only employee within the firm. They currently have insurance through their former employer, early retirement, but it seems high for 2 people. The cost is $785. How can they receive realistic monthly quotes without being bombarded by sales calls between now and December 15th?
Okay, so 2 parts to this. One, the $785 a month might actually not be that high. I don't know where you're living right now. I don't know what your age is or anything like that. But $785 might not be crazy. Unfortunately, insurance can be very expensive. But if you're looking for quotes and not getting bombarded by sales calls, I don't know how to fully prevent it, because even if you sign up for the marketplace, it's not sales calls so much as they are going to follow up because they're trying to get people to enroll. Good thing is it ends on December 15th. So if you can tolerate 2 weeks of people trying to give you information on health insurance, what I recommend doing, through our website, like I said, we find that Health Sherpa does a better job of helping you navigate the marketplace, but you can go on healthcare.gov and look at the quotes there. I mean, I think that's what's going to give you a realistic option. Just keep in mind when you're looking at your former coverage and you're trying to compare it, you don't want to look just at the premiums. Look at whether there are network limitations or there are certain doctors that you want to keep. Take a look at the deductibles, and also copay if there are certain things that you regularly do. And then also, of course, prescriptions. So it's not apples to apples when it comes to comparing plans like that. You really want to look at all of those factors.
Thank you. And this person says thank you as well. They really appreciate it. It looks like we have answered all of the questions that have come in. Is there anything else that anybody had to ask for Eve while we have her on? This has been an incredible resource for us, which is really nice. Well, I am going to say again that we are recording this. We'll have it up later today. I'm also going to send out an email later today to everybody that registered for this webinar with resources and information about SoleVenture and Smith.ai if you're interested in Smith.ai and not already a customer of ours. And thank you all very much for joining us. We are doing lots of webinars like this just to help small business owners. So you can sign up for our email list if you'd like at Smith.ai, or you can learn about all of our webinars that we have going on our Facebook page, which is facebook.com/virtualreceptionists, which is just one word, no spaces or dashes or anything. And again, thank you so much for coming on, Eve. This was really incredible, and it was wonderful to have you.
Yeah, well, thank you so much. I really appreciate it.
All right. Thank you, everyone.